Hi, everyone. Good morning, some of you, and good evening as well. I'll begin the session within next 2 minutes. So just give me next 1 to 2 minutes. Thank you. Okay, we are also live on YouTube right now. So welcome back, everyone. This is going to be part 4 for mental health today. And I already covered part 1, part 2, part 3. So those who are very new to my channel, students who are preparing for NCLEX exam or NORCET exam, just so you know, I already start this mental health series. So you can watch my other classes later on, but I highly recommend to watch them first before actually you jump on to the next class, right? I hope everyone doing good today so far. Now, those who are very new, just to let them know, I'm joining from Canada right now. It's almost 9:30, close to in the nighttime. And sometimes I actually take a leave for 5 minutes in between if I need it, because I do have a little baby with me who is sleeping in the next room right now. So just in case if my baby wakes up, I might need to run just to see my little one. Okay. So a little bit heads up for all of you, just in case you're wondering where she go, right? Now, definitely, this class is going to be helpful for both the one they're messaging for NOSET and NCLEX. Yeah, welcome to this channel. So let's get started in today's class. In today's class, actually, I supposed to do more topics today, but I really apologize, everyone. My health is not a little bit good today. I have a very bad headache at the same time. So just in case if something you don't understand, let me know right away. You can use your chat box as well. I'm actually live on both sides on YouTube and also the Zoom class as well. So somewhere you don't understand, use the chat box for me, please. Okay. I'll try my best to explain you as much as I can. So let's get started without wasting the time now. If you do have this Saunders book with you, everyone, it's highly, highly recommended. If you want to pull your Saunders book with you, just for the reference, in case you want to read something over there, you want to look into the information. And sometime I also use the book at the same time as well. So it's easy to refer the Saunders book, right? Saunders book, 9th edition, if someone has it right now, you can just let everybody know what page number is the Delirium, Dementia, and Alzheimer's. Maybe someone who has this book, 9th edition, or even someone has a South Asian editions as well. Let everybody know using the comment section what page number is that, so everybody can open the book at the same time if they have it, and they can read it from there, okay? But those who do not have the book right now, that's okay. Don't worry about it, because I'm going to discuss these topics in a very simple and easy language. So even if you just listen me, you're still going to understand the topic for sure. Okay. So one person already commented at the bottom. I can see 9th edition. They said the page number is 968. So I'm going to start doing the screen sharing first. So look at the screen and see if you can see the presentation as well. It's not a really presentation, it's just the blank page for the discussion today, because we have to use this sometimes, to discuss some client conditions at the same time. So the first one topic I have it for today is the delirium, dementia, and Alzheimer's, right? I know sometimes students, they get confused in all three of them, and sometimes they don't understand the difference also between three of them, and especially between dementia and Alzheimer's. So I will explain it first in a very simple and easy way. And after that, if you want to read it from the book as well, feel free to read it. Something you don't understand, you can let me know at the same time, as I said, or you can always contact me later on also on WhatsApp. Okay. Sometimes you really need the extra support. Sometimes you don't understand the topic. You can connect with me on the WhatsApp also. It might take a little bit time to get back to you with the messages. So if your exam is coming closer, maybe just give me a call so I can assist you right away. Okay, so the first one we have is the delirium. So to understand the delirium, I would just consider an example maybe here on the screen. So imagine the number one is my delirium patient, right? And the number two is the dementia patient, which I'll talk about it later on. And the number three is the Alzheimer's patient. Okay, just as an example. Now, the first one, which is the delirium patient, remember what is the delirium is basically. They all look very similar because in all of them, there is like a memory loss problem. The patient cannot think something sometimes, cannot recall all the information. But what is the main difference between, if I say what is delirium actually, delirium, when it happens suddenly in someone, okay? It doesn't really take time to develop it. It just happens suddenly in someone. And usually it starts within few minutes or few hours, right? And it can stay up to couple of minutes as well, or after for few days as well it can stay. But definitely it is reversible. If we treat the delirium on the time, this is reversible. But why delirium happened to this patient number one? Why delirium happened? So this is usually happen if someone already have a medical emergency before, or maybe a medical condition before, which leads further forgetting the memory at the same time. So for example, if my patient number one just come out from the surgery, right? And after that, this patient cannot recall everything maybe suddenly. So that is we call delirium, because person does not have that problem before. Now it just started. So that is a first common example. But it could be any other example as well. Maybe someone has a lot of infection inside the body, and that infection leads further confusion and memory loss at the same time. So delirium basically happened into that patient just because of the existing infection. But as I said, not just infection and the post-operative clients, it can also happen in someone who has a very high fever, and due to some usage of drugs as well, like overdose of the drugs. And even if someone has a lot of electrolyte imbalance going on inside the body, so their acid base is pretty much imbalanced, or someone had like alcohol dependency before, but suddenly they just withdraw from the alcohol. So confusion can be started in that person as well. So these are the common examples, like in which patient, in patient number one, delirium can happen, right? But as I said, this happened basically suddenly, okay? It doesn't really take time. It just happens suddenly in someone. Excuse me. Now, moving on to the next part. In delirium patient, remember the memory loss, confusion, whatever they have, it's actually fluctuate throughout the day. That means what? It's not same maybe all the day when you see this client. So maybe in the morning, your this patient is okay, but after a couple of hours, the person is like, I don't remember something right now, where I am right now in this hospital, right? Why I'm in here right now. So it could be any other type of confusion as well, but it's basically changing. And maybe after 2, 3 hours, it come back again to the normal, right? But usually in delirium patients, the sundowning is pretty common as well if it's a very old age person. Now, what is sundowning? Sundowning, right? Sundowning is also a very common question, which everybody needs to know. And especially, I would say, if someone is going for the LPN examination, which I call RPN examination, or the REX PN exam as well, if those students are attending this lecture right now, these are the common questions in their exam. So sundowning is nothing. Sundowning is basically, they said it's actually linked with your hormonal imbalance when the sun sets. So by the end of the day, when the sun sets started, so for example, around 6 o'clock, maybe the sun just set now. After that, you will see a lot of confusion in this client, especially. in the first one, delirium, which I'm talking about, right? Why? Again, it's a hormonal imbalance related to the weather, related to the link to the sun. So when it's a sunrise in the morning, they usually feel much better, but throughout the day, they are okay, fluctuating in between. But especially during the evening time, especially if it's an elder person, the sundowning will kick in sometimes, right? And this is very common. You will see, just in case, after you got the RN license, when you start working in the long-term care sites or in nursing homes in the country like Australia, Canada, USA, you will see these patients very common when you're working in there. Like in the evening time, they get so frustrated and agitated as well because they cannot recall where they are right now. So sundowning is pretty common into them, just in case you want to remember where the sundowning is and what it is, right? Now let's talk about, is delirium is reversible if it happened in someone, right? Delirium is basically reversible. As I said, you look at the cause. Why delirium happened in someone, right? If you know the cause, definitely you can treat it on the time, right? So for example, infection, if you look at the infection ahead of time, you start the treatment in the patient, you contact the physician, you got the orders and everything, your patient doing better, fever is getting down, this person will feel the better as well, right? So basically look at the causes and make it reversible, right? And now depends if it's going to be reversible within few hours or 1 day or 2 day, that depends, but it will come back again for sure. It doesn't take many months, right? It just come back quickly as well after few days maximum. Now, the next one, I'm going to tell you about the some common symptoms, right? What you can see basically in delirium patient, right? Now, those students who are already writing down, that's good. But some students who are not writing down when I'm talking about something today, right? Because I know there is no notes on the screen. You're going to refer Saunders book for sure after this, but you can always replay my this video also, because this video will be saved on the YouTube. So you can always replay back later on as well if you want to listen all these notes back again. And sometimes if someone needs handwritten notes, you can always let me know in the comment sections as well in the YouTube. So later on, I can provide you some presentation, some notes as well, what you needed, right? Now, back to delirium. So delirium, basically what other symptoms you're going to notice in there? So you will see this person, as I said, confusion, acute confusion. It just like happened, right? The second common symptom you're going to see into them is the hallucinations. Hallucinations are very common as well into this client, especially I would say visual and auditory. Those are the very common hallucinations you will see in the delirium person. Apart from that, this person will be more restless, more agitated, because their sleep cycle is also affected at the same time. So let's say if I'm the delirium person, I don't remember where my textbook right now. Where did I put my notes? Where did I put my cell phone right now? Definitely it will bother me, right? So I cannot sleep enough in the nighttime because I'm just keep asking myself where it is, why I'm forgetting this thing, am I doing okay, right? So definitely this is what we call what is happening with the delirium person, and it's affecting their sleep cycle. So that's why they get more restless, agitated, irritable, right? Those kind of behaviors is very common into them. Apart from this, if they don't get a good sleep, or basically confusion is affecting too much to them, so that can further also lead the poor concentration. They cannot focus enough for anything. So let's use the same example. If I'm the delirium person right now, I cannot find where my textbooks for nursing right now in my room. I'm just looking for it, but I can't find it right now. After that, if someone give me the food to eat, I can't focus, right? What is in front of me? Why do I need to eat that, right? Same thing. Maybe it could be another example also at the same time with me as a patient. Maybe you are showing me like a family photo and I can't recall quickly who is my mother, who is my father, maybe there, right? It could be any example, but something where my concentration power is also getting bad little bit as well. Now, That is all brief information about delirium patient. Now, the easiest way how to remember delirium, which I think a lot of students gonna like this way as well, like how do you remember the delirium, right? I actually find this very interesting. So delirium, if you see the word del, right? Del. So those who live in India, maybe they know Delhi, right? Delhi city, right? So they can maybe think from Delhi. Those who do not know much about India country, they never been there before. For them examples, just think this is a big city, the name of the big city as an imagination, right? And if there is a big city, for example, as I said, the name of the city may be Delhi, right? So in that case, you always think in that city we have what? Like lot of traffic, roads are very busy, and there's a lot of like you're gonna see the traffic like all the time, busy time. You don't enough get space to go somewhere. So this is definitely related to the delirium. Just to think as a funny way in the exam, you can recall it because confusion will be created with a lot of traffic as well, right? And definitely sleep cycle could be affected too. Person can become agitated, hyperactive, right? They can become aggressive too as well. So those all are very common things you're going to find in the delirium patient. So this is how you can remember easily in the exam. So I hope everyone understand what is the delirium look like, right? I'm just going to see some messages here on my screen right now. Let's see. Okay, someone says share the notes regarding the topic because I don't have the book. Okay, if you're preparing this exam for the NCLEX, I highly recommend to have this book. But for which exam you're preparing for, you can let me know later on, maybe in the messages as well. But yeah, if you're preparing especially for NCLEX RN or NORCET examinations, you highly need this book because this is the base. I always call it as a Bible for the content, which everybody needs to know for those type of examination. And someone says they cannot find delirium into the book. I hope you find it now. Okay. Okay, not much explanation into the book. Okay. Yeah, if it's not much explanation into the book, then I would recommend it. Play my this video back again. You can write down some notes as well, or either send me the message or put it like in the comment section later on as well. I'll just give you guys the notes on the same topic, whatever I'm talking right now in here. Okay. So that is about the delirium. I hope everybody understand delirium topic as well. If anyone has any question, any doubt in delirium, you can always use your the chat box for me, and even the YouTube students also. I'm also watching the YouTube, the comment section again. So if you have any question for me anytime, you can always type in the comment section, everyone. Now, moving on to the next topic. The next topic we have is the dementia, right? So let's see what is the dementia, right? But before, sorry, we look at the dementia, it's a good idea if you actually look at the Alzheimer's, right? Why you want to look at the Alzheimer's? I'll tell you in a few minutes, right? Because after Alzheimer's, you will see dementia stage basically, right? So let's talk about patient number 3 first, right? Then we will come back to patient number 2, okay? So in the Alzheimer's patient, right? Again, it's a memory loss problem again. But what is the difference in the Alzheimer's? Alzheimer's is basically, you can say, that is happened after the delirium, right? So imagine if I have a delirium, let's say at today's current age right now, maybe I have this ongoing issue for a couple of years, right? And after the age around 60, 65, I might get diagnosed or go into the Alzheimer's because in the Alzheimer's, the actual brain structure, the actual physical, the structure, and even the functioning of the brain already get affected with the time period. And Alzheimer's patient basically, when they get affected with the memory loss, it's not reversible. Okay, so this is something which is very serious. We need to look into. This is not reversible. But what actually happened into them? Their problem gets started slowly, progressively. As I said, it does not happen right away. And the patient even don't understand when does it happen, right? So let's say at the age of around 65, I don't even know I got already diagnosed with the Alzheimer's because I'm so used to with the time period with the many years forgetting memory. So I don't even know my brain structure is already being changes everything into there and I can't recall all the information now, right? So it's just getting permanent now, you can say, right? So basically, why does this happen? Because the nerve cells they get degenerated inside in the brain, right? So that is the mainly issue, and that makes the brain size become squeezing, structural changes and everything, and affecting the memory of the person, right? Now, the main features I would say when someone get affected with the Alzheimer's, right, they usually have the short-term memory loss, right? Initial stages they will be like slowly forgetting the things like the recent events. For example, maybe I went for wedding today, and after I come back from the wedding I just forgot I went for the wedding, right? And even I also forgot where I am right now, right? Is this something my own house, my own place, or is it something different, right? So basically any recent activity they start forgetting it slowly. Another example, maybe I just had a chicken soup or something, and after I had a chicken soup I just forget about it that I already eat something right now, and I'm asking someone, can you give me more food, even if I already eat it, right? So those are the slowly steps, in the Alzheimer's patient. They don't become right away, right? Now, initial stages, this is what happened with them. But later on, these patients, they start becoming more confused, more bad memory impairment. The judgment is just getting more bad with them. They can't see, they can't recognize everything into there. So even if you show me a book, I would be like, what is this in the late stage? Because I don't know this is a book. So this is how my brain gets affected. So this is something definitely very sad to see it. Now, in very severe cases, the patient usually cannot talk and they cannot swallow, even they cannot walk as well, right? Again, excuse me. So this is very sad for the Alzheimer's patient to see it, right? So if this is something happen, of course, it's affect the person life, the daily life activities, what they're carrying out, because they are not able to carrying out no more, right? They cannot use the washroom, they cannot bathe, they used to do it anymore. They cannot eat the regular food the way they used to eat it. Even this is sad to say, they cannot remember their family members, their kids as well. So this is something affecting a lot in the severe cases in the Alzheimer's in the late stage. Now, how you can remember Alzheimer's pretty easily? Alzheimer's, right? As the spelling indicates, Alzheimer's from AL, you can remember always, always progressing. So it's not something happened right away. It's always progressing slowly, and affects the brain of the person one day permanently, totally not reversible, totally like permanent, and it's not reversible at all once this is basically going to be happen. Now, one thing I want to highlight it here, because this question is a very common exam question actually. I don't know if this is given in the Saunders book or not, but you can always look into later on with me as well. So most of the time, they always ask you, even not just for the exam, but after you got the license, let's say you got opportunity to work with the Alzheimer's patient. How do you deal with the Alzheimer's patient? If I ask you guys a little small question, um, if as a patient, as Alzheimer's right now, if I'm asking you something, let's say, for example, I want to go home, right? I want to go home because I'm missing my home, right? So what do you think what you will reply as a nurses to me? So let's use your comment section. If I'm the patient, I'm asking you this type of question, how do you deal with me at that time, being as a nurses? So let's use your critical thinking first. Even whatever you know, just feel free to type it up, right? Even if it's wrong, right? Feel free to write down everything into there. See who knows the answer, right? Then I'll tell you answer in a 1 second. If somebody knows, how do you deal with me at that time? If I'm asking you as a patient Alzheimer's, I want to go home. Do you think you will tell me right away, being as a nurse, no, this is your home, right? Are you going to say that? I can see one answer. Norman says, show the picture of family members who is missing a patient. Very good. But why did you do that, Norman? Is it something you are distracting me? Or is it something you are giving me a reality about my family members? What it is? What if I ask you, being as a 65-year-old woman, as a patient Alzheimer's, and I'm asking you, I'm missing my mom and dad. I want to see my mom and dad. I want to play with them, right? Is it something you want to give me reality? My mom and dad is no more living, or you want to maybe um, like distracting me at the same time? Sorry, everyone. Just give me 1 minute. Just in case if I left the class, I'll come back within 2, 3 minutes. Okay. I'm just looking into right now. Okay. Hopefully my baby gets settled down. I thought he's up, so I have to leave the room. But anyways, he gets stopped. So back to the same question, everyone. So if as a patient, I'm asking you this thing, what are you going to respond? So the nurses who don't know the answer, as I don't see much responses in here, the right answer I will tell you is you do not show the patient reality. And this is the only something you want to remember in the whole mental health. Every patient in mental health, you give them reality, right? But this is the only exception. Alzheimer's patient, you do not want to give reality, even dementia also, sorry. You don't want to give them reality. Reality means what? So don't tell me as a nurse that this is my place, this is my hospital, it's my room, I live in here, I can't go home right now. So don't say those things to me when I'm asking you, I want to go home. Why? Because that will not work with me, because my brain is already get permanently affected with the memory loss, right? So if you telling me something with the reality, I'm not gonna understand as a patient. Definitely in return, I will fight with you as a patient. Maybe I will punch you back. Maybe I will become more aggressive with you. Why are you stopping me? Right? Okay. So this is something you really need to remember it. Like, don't give reality to these clients because it's not effective. So what you basically do is, Raki put very right answer I can see in here. So basically, you validate the client feelings, definitely, and you also redirect them, right? You validate the client feelings, you redirect them. But remember, when you redirect them, you do not change the topic. Very important, right? Very important question I'm telling you guys as per the NCLEX exams too. So do not change the topic. What does it mean? So in the answer case, pick that answer. If I ask you this question, let's say as an MCQ, so pick that answer in which you are actually talking about the same topic, right? But you're also validating my feeling at the same time. So maybe, for example, the right answer near about maybe, okay, how about if we go to your room and we see where's your the family address information and where's the family pictures right now, right? Because if you talk in that way and you take the patient to the room away from the escalating door from the hospital because they're trying to escalating the building, I want to go home. So definitely, it's just you keep the same topic, but redirect the person at the same time. And by the time they go to the room, this person will forget what they just said, right? So this is something we're gonna work very good in that manner. So I highly, highly recommending, and because I know a lot of nurses, I know when I used to work before on the floor as well, here in Canada. So I have seen so many nurses every time when you see in the practicum, they actually tell the patient, this is your home. Don't go anywhere. So this is something we should not supposed to do it being as a nurses. We need to redirect them, but change the topic. Okay. I highly, highly recommend everyone, even for your exams too. Okay. So this is the answer for this question. Now, I think I cover up everything highlighted stuff in the Alzheimer's as well. If you do have any doubts, any questions for me too, feel free to put in the comment section so I can address it for you at the same time. Um, and again, once after that, when you read from the Saunders book and you feel like something you don't have like clarity in the language or something, you let me know so I can help you further understanding the topic, what you're reading in the home, right? Now, moving on to the next topic, which is the Alzheimer's, right? Alzheimer's is, the Alzheimer's we just covered, but the moving on to next topic is dementia now, right? So back to your patient number two, if you want to compare now your dementia patient, basically, dementia person, I would say, again, it's the slowly, gradually, it happens, the memory loss in this person, because you can say Alzheimer's is a type of dementia kind of thing, but it happens after someone has Alzheimer's. So it's like a next stage to that, right? Now, in the dementia patient, the onset is like steadily declining. Okay, everyone, I have to leave the room for 2 minutes. I'll be right back. Okay, just give me 2 minutes, please. Thank you. Okay, everyone. Sorry for that. I'm back in here. I hope everybody's still here. You're listening me. Thanks for waiting. Those who just joined, maybe they must be like, where is she? Where she left, right? So I'm still here. I was talking about the dementia condition. So let's wrap it up quickly. I know it's take longer. I should not supposed to take longer today because I'm not feeling well. I already tell everyone. But quickly going to dementia. So dementia, remember, first of all, it's not a medical condition. I want to highlight it this one too, because it's basically not a disease, it's a symptom. But in textbook, you will find as a disease, first of all, okay? But it's not a disease, it's a symptom, and it happens because of the most common cause, Alzheimer's, after that, right? Now, in the dementia patient, as I said, it's a symptom itself. So you can say the dementia is a it's this symptom happened, the Alzheimer's in the dementia. So not just Alzheimer's, other symptoms also affecting at the same time, which makes dementia sometimes as accounted as a dementia syndrome in some of the books you will see. Excuse me. Now, what is the dementia syndrome? If I say syndrome is just nothing, that means a lot of symptoms in that dementia patient, not just Alzheimer's, but also other symptom comes at the same time. For example, memory loss, confusion, right? And if the patient having the trouble in doing any daily task as well, right? So multiple symptoms, not just the one symptom at the same time. So it can also lead itself as a syndrome also, not just the one symptom itself at the same time. I hope it's not confusing because I don't want to being in rush at the same time as well. And you guys are not understanding. If it's understanding, you guys understand as well. Let me know in the messages so I can help you at the same time. So I can see some comments here. Dementia is a chronic organic brain syndrome. Yes, it is. Excuse me. Yeah, it's a chronic problem because it takes time to develop it, right? After the Alzheimer's, it will become, and it's, yeah, gradually chronic, irreversible. So those are good words to somebody who uses these words as well. I don't see any other comments in here so far. So let me know if someone has a doubt for me so I can address it for you, right? Now, this is the main difference between delirium, dementia, and Alzheimer's, right? If someone still has a doubt for me, you can let me know because I'm still checking the chat boxes right now. I don't see much messages in there. But if it's clear for you, please just say once clear, 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 if it's clear for all of you, because that will make me feel comfortable that you understand this topic before I jump to the next topic, right? So is it clear for everyone? What is delirium, dementia, Alzheimer's? Any doubt for me so far, please? Okay, I can see a few clear. Okay. Okay, other students are also clear with this one? Yes. Okay, wonderful. So even after watching this video, you still have a doubt, you let me know later on. Okay. Excuse me. Now moving on quickly to the next topic for today, which I call it suicidal behavior, right? Sorry, everyone. My health is not doing good today, and that's why I'm coughing again. So I really apologize if you're seeing me very first time today, right? Especially. So maybe someone who wanna pull the page number for me for the ninth edition in the comment section. I have a different edition with me right now, so that's why I cannot tell you the page number as well. So, but gonna use the chapter Crisis Theory and Intervention. It's a chapter name from the Saunders book itself. And in this chapter, I'm going to choose the topic suicidal behavior. Okay, this is the next topic for today. Now, suicidal behavior is what, right? As the word already indicate, if someone has a behavior to commit the suicide again and again, right? This is how you diagnose someone, right? Because they do have a feeling always being worthless. Why is it me? I'm losing hope in my life, very guilt feeling. I want to die. These are the common things what they usually feel in their life. Now, How do you know when you work as a nurse on the floor, right? How do you know someone can commit suicide? So you look at some clue, some idea, that makes you alert, oh, this person might can commit suicide. So I'm going to quickly read it for you, those clues right now, using the book. It says giving away personal special prized possession. That means, imagine if I'm the patient and I'm giving my expensive watch to someone, right? And I'm just saying, okay, I don't need it anymore. You keep it with you, right? So that could be an indicate like I might gonna commit suicide because I'm thinking about it. I'm giving away my expensive stuffs to someone. Canceling the social engagements. So they don't go anymore to meet someone on the floor. They used to be very good, but not anymore now. The next example here is in the clue is making out or changing a will. The person make a will, like in the will they write it down everything, what they would like to do with the property, financial stuff, everything after they get die. So maybe I create a will before, I write it down something else on that, but now I'm maybe trying to changing it, right? So if I'm making some changes, maybe something going on in my mind, like why do I need to change it, right? So some students already put the comment section. The page number I can see here is 990 in the ninth edition of the Saunders. Thanks, Babavi. Sorry if I say your name wrong, but this is what I got the comment in here. So thanks for telling the page number. Now, moving back to the suicidal clues. So in the suicidal clues, taking out or changing the insurance policy. Maybe if I had insurance policy before, I'm just going to cancel it. Maybe it's a life insurance, right? I would be like, I don't need it anymore. Let's just cancel it, right? Apart from that, positive or negative changes in behavior. It could be positive, it could be negative. Positive means it was not there before, but now it just come, right? For example, being as a patient, I'm just telling you, the nurse, I want to go to my daughter graduation next week, graduation ceremony. It sounds like to you like, okay, she wants to go, right? Because she's happy about it, but that's something maybe going on in my brain. Why I wants to go in there, right? Similarly, negative changes in behavior. Maybe it was not in there before, but now it just comes. So negative changes could be like, maybe I never used to, say no to someone for anything. And now I easily get frustrated with someone, even if they come to my door. Maybe I try to use my voice really louder, aggressive behavior that was not there before, right? So something bothering me, maybe. That's why I'm having those behaviors right now as a negative. Apart from that, you feel like poor appetite, you don't feel like to eat much, right? Or maybe you quit to eat because you're thinking you want to die, right? Sleeping difficulty, feeling of hopelessness, right? So sleeping problems could be there too because you keep thinking about to get die at some point, and then you feel like no more hope. Why I need to live this life anymore? Difficulty in concentrating, right? So let's say maybe the nurse comes to my room and she's asking me a question right now, but I'm not able to concentrate what she's asking me right now because I'm just thinking, preparing my own plan in my brain, right? Apart from that, loss of interest in activities. So if someone asks me to participate, I'm not gonna maybe participate into there. It could be any activity, maybe just watching TV, playing a game. It could be anything. Client statement indicating an intent to attempt suicide. So sometime, patient tells you, right? Like, nurse, I don't feel like to live anymore, right? So they give you direct cue, like, I want to die. So this could be also happen. Sudden calmness or improvement in the depressed client. Very important point, right? Sometimes you feel like your depression patient never used to talk before, but now suddenly that person is laughing, smiling, or maybe they talk a little bit before, but now suddenly calm down, right? So it could be any changes in the mood into them, which was not there before. Excuse me. So this can also happen in the suicidal cases as well. Maybe they're trying to giving you cue. This is what's happening with me, right? Apart from that, client inquiries about poison, gun, or other lethal items or the object. Maybe person is asking you, do you have any knife on the floor, right? Do you guys have something sharp to cut the apple? They will give you a clue what they're looking actually right now at this point. So these clues, if you see somewhere, you should be very alert as a nurse right away and need to do something right away, right? So let's see now what you're supposed to do right away, right? So, if I quickly read your nursing interventions, what you can do as a nurse, of course, you make sure the surrounding environment is safe. You remove all the sharp objects, everything in there. And it also depends how quick is the scenario is, right? Maybe if they just give you a kind of cue and they're still waiting to do that, you remove the sharp objects first and stay there. One-on-one nursing intervention, very important. Or tell somebody to stay there if you cannot stay as a nurse by yourself, right? Apart from that, you actually assess for the if the patient really have ideation to do something, right? But if you already assessed that earlier, it's good. That gives you clue already. Apart from that, when you're caring as a nurse is in there, be non-judgmental nurse at that time, right? Because if you're trying to be being a judge with that person in front of them, they might not gonna like that behavior and they will do what they wants to do because you are aggravating them with that behavior. And it's also being as a nurse, this is non-professional. I already talked in my previous videos in therapeutic, non-therapeutic communication skills, that always be non-judgmental nurse. Okay. Apart from that, you need to make sure you ask the patient to encourage, to talk about their feelings if possible. Well, I would say this is tricky. If this is something you have a person diagnosed with a suicidal behavior on the floor, yes, you have a time to ask about these things. But if someone already give you a clue, they want to commit suicide, maybe you don't have that much time for that. So in that case, I'm not going to waste my time. I would just simply ask the person a direct question, closed-ended question at that time. Do you want to kill yourself? Do you have any plans right now? Do you have something in your hands? Can I see it? Right? Have you thought about to kill yourself? So basically, any question related to direct answer, not something to make a story around in that area. That's something I want to ask in that situation if it's something really acute stage right now. But if the patient do not have any plans right now, it's just being they diagnosed with that, but they don't have any plans right now, then those things can wait. Those assessment questions can wait. Then maybe in that case, I will go inside the room, sit with the next to the person and ask the person, like some questions so they can tell me more about their feelings. How do they feel while they're staying in the hospital or the place where they are right now? So apart from that, you try your best to talk about the positive things with them about themselves if you do have a lot of time again. But if the patient is already trying to committing suicide right now, they give you cue, you don't have that much time. But as I said, if right now, let's say no behavior to give a suicidal, then at that time, you can ask them like, oh, do you remember what you used to do before in your life, what makes you happy about yourself, right? So something which you think the patient gonna like about it if they talk about that. So that gonna initiate the conversation in that case. And of course, it's make a trust relationship with the nurse between nurse and patient, and maybe they can vent out their feelings too. Now, apart from this, try your best to see if any visitors comes in that room as well. Maybe any visitor from the family member or friends, if they are, always see they don't have any sharp harmful objects bringing with them. So always check with them first in the nursing station before you send them in the client's room if possible. That is always usually a great idea. And apart from this, the last one I want to say is, which is very important, as I said earlier also, do not allow the patient to leave the unit by themselves, right? Or you do not leave the patient alone for extended period of time if you already know that the person can commit suicide at any point as well, right? I got a question on my screen. It says, ma'am, if a patient is deaf and dumb, how assess the patient in the suicidal case? So if there is a deaf and dumb, okay, a very good, interesting question actually. I would say if the patient is deaf and dumb, um, well, do you think your patient can see like a lot of stuff in there or no? This is my question back to you, Malik. Maybe I want you to unmute for a second with me so I can answer your doubt and we can participate together. So just give me 1 second. I'm gonna make you unmute on my end, okay? If you wanna participate with me, that will be great. Just give me 1 second so I can make you unmute. Mm, where is your name, Malik? Okay. Malik, I already sent you a request to unmute yourself. Do you want to come forward and participate with me, Malik? Because it's a really interesting question I can see, and I would love to participate with you together. Do you want to come forward? I already make you unmute. Okay, if you're not available for the voice message, that's okay. Let's answer this question together. I would say, let's imagine maybe as a nurse, sometimes we can't think enough. So if I'm a patient, right? And as a patient, I really don't have capacity to hear something in that case. So what I will do is if I want to commit suicide as a patient, I would be like, um, hold on, maybe as a patient, I would just make some actions, like what I was supposed to do, I'll just do it. For example, maybe creating a bed, right? Preparing my bed somehow because I want to die. So I want to put my bed sheets in that way, maybe my clothing in that way, putting some flowers in there maybe as well, right? Yeah, behavioral changes for Bina. Yeah, that can also be happen at the same time. So as a patient, this is what I will do if I'm a deaf and dumb at the same time, right? But yes, Manpreet, yeah, refuse medication. That is also a good one. But let's say if you are the nurse now on the other side, what are you going to look in this patient, right? I would be looking, some weird behavior with their body gestures, right? So if the person has a changes in the, how they used to walk before, their walk is being changes now, their eating pattern is changing now, the person actually trying to preparing something for themselves, which they never did it before in their life. Even if they are deaf and dumb, they can do that, right? Yeah, body language, very good, Raki. Yeah, as I said earlier. So this is how, as a nurse, I will look into that situation. So I can figure out what's going on with my client, why this client looks so different today. And even let's say the Manpreet example, she said refuse medication. So if being as a nurse, you give the medication to them, right? And the person doesn't want to take it, just walk away from you, even if it's not a medication, but something you try to give it to them in their hands. They don't want to hold it, just walk away from that situation. So definitely this is sounds like a refusal, right? And in case of sudden refusal, I would be very concerned about it. Like why my patient is doing that? Is it something concern I need to look into? So in that case, I will talk with my patient at the same time. So how do you talk? Because your patient is deaf, right? So you find the other method for communication in that case. So if they can't hear, but they can see maybe in that case, or if they can't see, then use the sign language, something holding their hand together so you guys can communicate somehow, right? So this is my answer for this question, the person who asked me this question. I really love that question because this is very interesting question, what I got today. So I appreciate it. If anyone has any other doubt question for me, feel free to let me know. And the person who asked me this question, I can see your name is Malik Mehran. If you do have still doubt for me, feel free to let me know so I can still address it for you. And the YouTube students even also, if there is any doubt in the whole lecture today before I leave, because this is all about the suicidal, what you need to know for sure, right? Okay, anyone has any questions for me before we leave today? I try my best. Okay, very informative. Thank you so much. Okay. Interesting session. Okay, well, thanks so much for joining today, everyone. The next class, hopefully, I'll do it again tomorrow around this time, so we can finish all the mental health other condition in a last go tomorrow. Hardly 3, 4 left, so let's maybe try our best to finish them tomorrow, and then after that, we're gonna work upon the mental health medications. Okay, so we're gonna try our best to wrap up quickly as much as we can. So thanks for joining today, everyone. I'll close the session now. We'll see you all back again later. Thank you so much.